81-year-old Jessica Wang, a Caucasian with 2-week history of diarrhea. She's having stools about every 3 to 4 hours, reports they're watery, mucousy, and yellow in color now with associated cramping pain. Reports the pain is 3 to 4 out of 10. Has several church circle members with the same kind of condition, no radiation of pain, meaning the diarrhea, that is, they have the same thing. Some pain under her right breast. She's had a 5-pound weight loss in the last 2 weeks, as well as increase in fatigue, decreased appetite. She denies blood in her stool, denies vomiting, nausea, cough, wheezing, shortness of breath, sore throat, chest pain, palpitations, urinary frequency or urgency, no incontinence of urine or stool. Has some joint pain from her arthritis as well as some back pain from her degenerative disc problems. Anything? Oh, denies fever, sleep problems, night sweats, and skin problems. Okay. Review systems. I guess I've covered all that. Past medical history. She takes Hyzar 100/25 for hypertension, warfarin 5 milligrams 6 days of the week and 2.5 1 day a week for AFib. She has an occasional NSAID for her rheumatoid arthritis, which mainly impacts her knees. Has degenerative disc disease, as well as some other old age things, bilateral cataracts, and MOH, I'm not even sure what that stands for, on her face. Okay, I don't know what that is. She had a previous cholecystectomy. Mom died at age 96 of, quote, old age. Father at age 93 of carotid stenosis. She does not know about her grandparents. Children and siblings were non-contributory. Social history. She lives alone. She was a former 10-year packed history of smoking, but has not smoked in many, many years now. Has 1 to 2 glasses of wine 2 to 3 days a week. It's, quote, simple meals, but sounds like they're fairly balanced. She is obese, pale and fatigued on exam, with mild tenting of her skin trigger, dry skin, has some red patches with central clearing under her breast, so I don't know if that's just some sort of rash from them rubbing, I would be my guess. Heart rate is regularly irregular at 66, blood pressure 122 over 68. Stool was negative for occult blood. Urine specific gravity 1030, so she's dry. All right, diagnosis. I think it's likely that she's got some sort of gastroenteritis with dehydration. Since other church members have it, you look at either Staph aureus, salmonellosis, viral gastro. Other diagnoses to consider would be some sort of carbohydrate malabsorption. Has she suddenly developed lactose intolerance? It can happen at older age. Irritable bowel syndrome, celiac disease, same thing as kind of the carbohydrate malabsorption. Does she suddenly have a problem with that? They don't seem super likely. Can't afford to miss would be maybe some sort of obstruction where she's still stooling around the obstruction, and so that would be my can't afford to miss, because I couldn't really come up with anything else there. What I would recommend is she's 81, she's clearly dry, she probably should go to the ED, get some IV fluids, stool culture, CBC, and a basic metabolic panel, and then kind of see what turns up. She'll probably cook up quite a bit with IV fluids, and then depending on what shows up on the stool, we need to give some sort of treatment for that. Otherwise, kind of let it run its course.